Hello everyone, I'm delighted to be here today to celebrate the first European Cancer Nursing Day as E.ON's president. Today is an important one because we are recognising the crucial work that cancer nurses will be doing today and every day in the hospitals, the clinics, the hospices and in people's homes all across Europe. Nursing is becoming a scarce resource and in some places extremely valuable. And across Europe, nurses really are at the forefront of cancer care.
Specialised cancer nurses make a real difference to patients, and I think the difficulty we have at the moment is that not everybody in Europe has access to a specialist cancer nurse, and that's what they really need.
The evidence shows that patients have better outcomes if they're cared for by cancer nurses and by specialist nurses.
Cancer care today is so incredibly complex, and the treatments the patients get comes with a lot of side effects and complications. So of course then the nurses also have to be specialized.
Today is about saying to our politicians, health ministers, managers and those whose job it is to improve cancer outcomes, you need to recognise the value of the nurses in your service, because without them, your goals may never become reality.
I think it's hugely important that we recognise cancer nursing in Europe. It makes me really sad when I talk to people in some countries that perhaps don't have a specialist nursing qualification, because it's so clear that what they do is incredibly valuable, but that their governments and their managers and their doctors that they work with don't really think twice about what they do. So I think it's something that is a responsibility for us all now.
Nursing as a profession is under-recognised. It's been proven by the WHO and the EU. If it's not recognised, we're not going to have a specialist training for cancer nurses in all the European countries, which is the situation today.
I think what we need to do is to bring cancer nurses together to make sure that there's equality in the resources and in the knowledge of cancer nurses. We need standards throughout Europe, and it's important that those people that already have established pathways for cancer nursing help those that don't, and it's about learning from each other. I think the other thing about being together in Europe is that we really do need to think about the aim of E.ONS, and the aim of E.ONS is to help all cancer nurses, so it's important to bring us all together.
So many things about being a cancer nurse throughout my career that have been amazing. I think firstly, working with patients and carers, working with families at some of the really difficult times in their lives, and knowing that what you've done has made a big difference to them.
Being a cancer nurse is the best job in the world, and you can be close to people, to patients and their families when they are in difficult times, and you can really make a difference, and that's an ordinary day at work, and not many jobs have the same possibilities as cancer nursing.
So what do I like about being a cancer nurse? Well, when somebody has cancer, it's a monumental event in their life, and it affects them both physically but also emotionally. They're very frightened, they're very worried, they have a very uncertain future. And by helping them through that, even being a part of helping them through that, you know that you're really going to make a difference. So in that way, it's a very rewarding type of job, and for me, it seems to bring together all the things that I like about nursing.
Working through E.ONS, working internationally, working on policy groups, with stakeholder groups, with patients and carers in patient and public involvement, and through research as well. I've loved it, all of it.
So thank you for sharing in this important day, for recognising the work that cancer nurses are doing. If you would like to help us in our work, contact us via the website, and please give whatever you can. From all our members and supporters across Europe, E.ONS wishes you a happy and healthy summer. Thank you.